Hi, my name's Damien Howard. I'm a psychologist based in the Northern Territory, and I've been researching the impacts of hearing loss, mostly related to ear disease, for over 30 years now. And this presentation is about improving communication with Aboriginal people with hearing loss. It can apply to people that you're working with, to children you're working with who have ear disease, or to the families of those people that you're working with who are also likely to have had ear disease and hearing loss as a result of that. So the communication problems related to ear disease are what drive disadvantage. And these communication problems start early in life along with ear disease and can impact on communication within families, with peers and friends and parents, aunties and uncles. So it influences how people communicate and how they feel about themselves and others from a quite early age. And then it can flow on to impacting on their educational outcomes because of creating difficulties in them engaging in learning at school and often having behaviour problems as a result of coping with listening in often a noisy environment with the hearing loss. It can also lead to limited access to healthcare when people are uncomfortable in situations where they're not sure of what's being said to them or not sure of what's being asked of them. And as we'll find out later, often respond to that with avoidance and disengagement. And unfortunately and ultimately, there can be a greater involvement with the criminal justice systems. And some research I was involved with a couple of years ago identified that 94% of Indigenous inmates in Northern Territory prisons had a hearing loss that impacted upon their communication. It's often assumed that the path of communication problems goes like this, that ear disease causes hearing loss, which then contributes to difficulties understanding what's said. But avoidance related to anxiety is an important compounding factor in these communication problems, as I'll explain. Anxiety is very common for people who experience communication problems, and the communication and failure and shame are very important for Aboriginal people in particular, where shame is a very important concept and process in Aboriginal cultures, which are more interpersonally focused. So being shamed in front of peers and others is very humiliating, and many of you who work with Aboriginal people will know that reason as shame is being given for not engaging in some potentially problematic situation where they may feel anxious and not understand what's happening. And shame is very common amongst people with a history of ear disease, and avoidance as a way of coping with that anxiety is also very common. So what begins as problems in hearing what is said, over time also becomes a difficulty in understanding what's heard. And here you can see someone sitting with a sign saying to school, and they're not going to school. And there's evidence that children with middle ear disease attend school less often than other children. So the avoidance as a response to anxiety works this way. Firstly, there's ear disease that contributes to hearing loss. Then there are difficulties understanding what's said. And then there's a desire to avoid the anxiety and shame that can come from that difficulties in understanding what's said. And the avoidance is particularly targeted at unfamiliar people talking about unfamiliar things and from another culture. So these are often people who are strangers, such as teachers, doctors, nurses, police, those people who are talking in ways and talking about things that people are often unfamiliar with. So over time, that avoidance then builds to having a limited understanding of English, a limited understanding of the context around the conversation. So that store of knowledge, of the context of knowledge that helps to place what's said within a framework of understanding. So that limited understanding of what's said then continues to feed into the loop of the desire to avoid anxiety and shame, and keeps on going round there, so that avoidance becomes more entrenched as a process of coping with those issues. And what are some of the indicators that someone has some hearing loss in your engagement with them? And these are based upon observations that I've made over many years of people I've worked with who have had some hearing problems. Particularly Indigenous people have a culturally influenced profile of engagement or lack of engagement. And starting with saying little, that people are wary of being shamed by misunderstanding, so they just participate little and say little in situations that they're communicating with someone that they find unfamiliar. Particularly people who they fear may be judgmental, those are people that they often engage with very little. Misunderstanding the comments or questions that have been put to them. Often people with these listening difficulties will miss the whole sense of what's said, but focus on a particular key word and interpret what they think they were asked or what the conversation's about, and run off on a tangent with that key word. And so they're talking about something completely different or largely different to what the person wants to speak to them about. And I'm sure many of you in the audience, the light bulbs are going on, remembering many conversations you've had that went along that direction. Another aspect is long response times to questions. Taking longer to response compared to others from the same community is common because more time is needed to understand what's said and to construct a reply. Now, this has been commonly observed and has been mostly ascribed to being related to cultural differences in communication style. And while that's true to some extent, some work that I've done analysing the response times of Indigenous people with and without hearing loss found that those people with hearing loss had the longest response times of any in the group. So while everyone had longer response times than, say, a non-Indigenous person would, those with hearing loss had the longest of all. So it's an important indicator that someone may have some hearing loss. If the person speaks quietly or loudly, and I'm sure all of you would have encountered people who speak very loudly, particularly in public situations, and it helps to understand why that's happening if you realise that they're likely having a hearing loss. There's a friend of mine who described that when she was riding along the foreshore in Darwin, behind groups of people walking along the path, that the groups of Aboriginal people who'd been sleeping down by the foreshore, when she came up behind them ringing her bell, that they took a long time to hear her coming behind. That she was almost right on them before someone would hear the bell and they'd move out of the way to let her pass. And she noted that when coming up behind non-Aboriginal people walking along that path, who weren't living on the foreshore but were just using it for recreational purposes, they heard her coming a long way off. So what she was doing an informal hearing test and finding most of those people living in the long grass had a hearing loss, and they were the people who would also be shouting out to each other in a loud voice that was sometimes seen as aggressive but was more often just at the level that they needed to hear each other. Speaking very quietly can also be something that's common for people with conductive hearing loss, because when they are communicating, they hear the sound that they're making through sound being conducted through the bones of their skull. You can do this yourself if you put your fingers in your ears and just to cover them sufficiently to create about a 20 dB hearing loss, and then start to talk. You will hear your own voice much more clearly than the outside noise because the sound's being conducted through your skull. So when someone has a loss and they're speaking to someone else, they hear themselves at a much louder level, and so it's harder for them to actually identify how loud they should be speaking to someone else. So it's common that they might be seen as talking quietly or mumbling. One young man said he was stopped by the police and they said to him, just stop mumbling and talk up, which greatly irritated him. And his mumbling was a product of him hearing his own voice more clearly than other people did because of his long-standing hearing loss. Intense face watching is another indicator of hearing loss, and that's to do with people lip reading or watching the person's face to get a sense of the emotional context or the intent of the person's verbal communications. Another is displaying signs of listening overload. So when people have had a hearing loss for some time, and with those associated difficulties of having problems in often understanding what's said, listening becomes much harder work. So they may listen for a time, but then are overloaded by that task and stop focusing so much. And you can see this when people have reached a listening overload, is when they stop focusing so intently, their face gives a look of unfocused gaze and lack of engagement. And when I see those kinds of indicators, I know it's time to stop talking, because the person's not really able to listen as they had been before. And that time of listening overload depends on the person, what's being talked about, etc. But it's important to take note of, because after that starts to happen, it's likely that you're not going to get a whole lot of attentive listening going on to what you're trying to say. It's common too that people have difficulties expressing what they want to say, because the impact of listening problems on expressive language can result in people experiencing difficulties constructing what they want to say. So, and this is most critical if they're put on the spot about being asked about something that there was no indication that it may come up. So just in normal conversation where something's asked that was not anticipated. And they're going to take more time to actually work out what was said to them, work out what they want to say, and then respond. And that difficulties in responding or taking a longer time to do it can lead to people being seen as being unmotivated or unintelligent, when in fact it's just an artifact of the hearing loss, and people need to be given time to be able to have what they say put into words. There was a lovely story by an anthropologist who was in a court case, and a witness in the case was being asked questions and was just taking a very long time to answer them. And the lawyers and the judge approached her and saying, well, what should we do with this? How do we hurry her along? And her response was, you don't. You just give her the amount of time that she needs to answer, and don't interrupt or redirect the question or rephrase the question. You just give her the time that she needs to formulate her response. And they did that, and found afterwards that she was a very informative and eloquent speaker when she had the time to put into her words what they were asking of her. Another indicator is when people come in and do what I call a scripted monologue. A scripted monologue is when someone starts out and they've obviously prepared something they want to say and they just continue saying it. They may be very uncomfortable with being interrupted, and in fact, if you do interrupt them, they may lose track of what they're saying and get flustered and find it difficult to reorientate themselves to the questions, or they may often just ignore what you've asked and continue till they're finished. And people describe it saying, well, I've spent so much time thinking about what I want to say and what I need to say, and I feel like I can't stop until I finish saying it. Or if I'm interrupted, I'll forget where I am in the scripted monologue, and then I'll get confused. So when people come in with a scripted monologue, it's another indicator that there are likely to be some listening problems, and as much as possible to allow people to go through that scripted monologue as time permits. And finally, when someone brings someone else to help with communication, that's a very strong indicator, particularly people from remote communities or who aren't that familiar with Western professionals. It's using what I call a social amplification system. Very few people in Aboriginal communities have hearing aids, but they have people who they can communicate well with that they will bring along to conversations to help them understand what's being said to them, and often get help to explain what's being said otherwise. It may be like an interpreter, but very often with people with hearing loss, there are quite, particularly the more severe hearing losses, there are idiosyncratic communication processes in family, so that family know what people are saying and how they communicate, which may be something that interpreters who are unfamiliar with the person may not know. Speaking in the person's first language is always going to be a whole lot easier for them to understand, but for some people with more severe hearing losses, they may also need that additional family input. I once worked with a man who'd been held in custody for almost 20 years for a crime that he couldn't be charged with because they saw him as unfit to plead, and no one could communicate with him. However, it turned out, with the help of an Aboriginal communication consultant, we worked out that he had some family members in the same prison who could communicate with him very effectively, but no one had thought to ask them to assist with communication when lawyers and various people were trying to interview him. So, looking at some ways to improve on communication. Firstly, some of the well-known ones are managing background noise, moving to where it's quieter, shutting doors, turning off equipment, and ways of making the background noise quieter so the person has the best opportunity of hearing clearly what's being said. And enabling the use of visual skills. When people have a hearing loss, they usually develop some compensating visual skills, particularly if that hearing loss is early onset. So they're going to be very visually astute at taking in information that's available in the environment or which is presented to him to fill in the gaps about what they miss around language. So if you can present a visual context to the words that you're using, you're going to achieve a much better understanding. So some of those things, using pictures, diagrams to explain, and of course making sure your face can be seen as you're talking. So being very careful not to turn away to put information into a computer that that means that your face can't be seen by the person, but particularly using those visual cues. One GP who after talking about hearing loss started to always draw pictures to help explain, said that he realised that a lot of the misunderstanding that he'd put down to cultural and linguistic factors were in fact to do with hearing issues, and when he added a visual component to his communication, the outcomes to his practice improved greatly. People understood more and participated more in treatment than they had when he had just been talking at them. One Aboriginal woman described about going to meetings for her was listening to blank faces going blah blah blah, meaning that often very professional non-Aboriginal people tended to show they were professional by not giving much away with their faces, but that made it harder to communicate and harder to understand what they were saying, and the blah 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 was too much talking over too long a time. Making sure that the language that's spoken is easy to understand. So where possible, using interpreters, but where that's not, speaking plain language and language that's within the vocabulary of the person being spoken to. And keep in mind that because of this, the lack of store of knowledge, it may be that the person may know partly what the word means, but not understand the full context of the word as you may assume it. So you may need to check whether the words being used are understood in the way that you think they've been understood. Encouraging social clarification, and that's bringing along a family member, bringing along a friend, having an interpreter who helps to convey in words that the person understands best, or in signs that the person understands combined with words, so that you get an informed response to the questions you're being asked and they can take in information most clearly. So this may be families and friends who do this. It's also important to make sure that there's time during your conversations with people for those people to do the conversations and the clarification. And in determining when that's important, I very much watch body language. If you can see the body language between the interpreter or the communication broker, and you can see that body language is indicating one or the other wants to have greater clarity, then use that opportunity to take a break and allow that person to communicate. In meetings too, I've found that whole group meetings can be quite overturned if there isn't discussion time during the meeting. And what happens during those discussion times is those with the best hearing, with the best English, let others in the group know what's being talked about, and so that a decision is made by everyone being informed and wanting to decide on that matter. Whereas if a topic is deemed or the meeting needs to be rushed through, it'll often be harder to get to a decision because people haven't understood what's going on. So sometimes the longer meeting with the break times to be able to discuss what's being said at key points gets to an agreement faster than a rushed meeting where that discussion within the meeting isn't enabled. Using amplification devices can also be very helpful, and you can see here that there is a handheld amplification device. These are very useful in particular situations, and I carry one with me in my consultations, but it's also very handy for people to have. Some people may not be comfortable using them, but once they're experienced, you'll find that they can be very popular. In fact, so popular you need to hang on to them, because once people have experienced amplification, they may want that to continue happening. And I find it's actually a great way to let people know that they aren't hearing the same as everyone else, and that by using those, they will introduce them to possibly going and getting hearing aids themselves. Once I loaned one to an Aboriginal health worker who took it to a child care centre, handing it around, and then the next time Australian Hearing came out there were 8 new people lining up because they've realised that they needed amplification. Support in pre and post learning. Prelearning improves understanding by preparing the person for what they're going to hear. So when people have a better understanding of the context of the conversation, they have a much better chance of understanding what's being said to them. So what this means is making what you're going to talk familiar before you talk about it. So this can be maybe creating a picture book or a video explanation that the person watches beforehand. So if someone's going for surgery, to have a picture book or a video walking through what that person's going to experience in the particular context. And with mobile phones and with video capacity, it's not hard to do these days in a local context to video where the person's going to be, who they're going to meet, what's going to generally to happen, so the person's prepared, and so the anxiety about what's going to happen isn't so great, and that they can participate in that. Post-learning can also be very important in improving understanding. Post-learning involves discussion after the conversation has happened to clarify what has been said. So things that can help this is material that could be read or listened to or viewed to help clarify again, what has been said. Again, with mobile phones these days, it's very easy to say, to record what you have said, the key points, and give that to the client to take away so that they can play that again with other people and get a clearer idea through discussion of what's been said. Otherwise, you might find that someone goes away and remembers what they said, and it's a game of Chinese whispers with the usual outcomes of that, of things being distorted. With clients with listening problems, I generally record some of the key points of discussions during consultation, get those transcribed up and send them to people so they've got a clear idea of what's been said. Because of their auditory memory problems and or listening overload, it's likely that they may not have had the best information available otherwise, unless I give them that written information. That may not be suitable for many Aboriginal clients where literacy is a problem, but video and other audio information can be very helpful in that context. Knowing that you've been understood is also very important in terms of the processes that people are engaged with. So one of the key things talking to people who are very successful in communication with Indigenous people over a long period is watching body language for confirmation of what's understood. Body language is far more important in Aboriginal communication than in Western communication. Our long history of literacy has meant that body language has been pretty well divorced from what's seen as important in communication in many senses, compared with Aboriginal people. For Aboriginal people, body language is still part of the grammar of communication in a way that it isn't so much for non-Aboriginal people. So watching that body language to see whether the person is, quietly silent and indicating that they haven't understood something and they expect you to further explain it, or whether it's a very definite affirmation that they've understood. And you can often do this through, at the outset of communication, asking some very uncontentious questions. Like, where are you from? And then repeating back, oh, you're from there then. You've got 5 kids then. And watching the very clear affirmation given in body language about those, and then compare later on how the person responds to the questions about whether they've understood what you've said. That'll give you a comparison to know whether the person's being polite and saying yes, or whether they're genuinely saying yes and have a very clear understanding of what's been said. If you're going to explain something again, and because you haven't got a clear message that from body language and or verbally that something's been understood, then it's good to offer to explain again, but focusing on you're not having explained properly in the first instance. So certainly don't say, oh, I don't think you've understood that, so I'm going to tell you again. If you take responsibility for the communication failure through saying things like, oh, did I explain that okay? Maybe I didn't explain that really well enough. I might tell that again. Is that okay? So you're taking responsibility for that communication not being successful, not blaming the person for not having listened well enough or understood well enough. So you need to keep in mind in this situation that people with these listening difficulties have had a lifetime of being blamed for not understanding because they haven't taken in what was said to them. So it's a very sensitive issue, and if it's something that can trigger an avoidance reaction if people feel that they're being blamed for not having listened well enough. So I'll break now for questions, but just to let you know that there's training available on these things, and it can be accessed at these contact details.